Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is Calcaneus heel spur. As one can see, this is the heel spur, the projection from the calcaneus bone, so it is called calcaneus heel spur, as it is just going to touch the hard surfaces if one is not wearing the proper cushioned shoes. It is going to cause the pain and leading to the plantar fasciitis and responsible for the pain in many people, and most of the time it is overlooked. So people confuse the terms heel spur and plantar fasciitis. These two are though related, but they are not the same. Other names are the jogger's heel, heel spur syndrome. Heel bone is the largest bone in the foot. It absorbs most amount of the shock and the pressure on the foot. A calcaneal heel spur is a hook of bone that forms on the heel bone, that is the calcaneus bone, and it is a bony outgrowth from the calcaneal tuberosity, and it is associated with the plantar fasciitis because it causes the inflammation to the plantar fascia. Now, here one can see the heel bone or the calcaneal, and here there is a spur or projection from the bone that is inflamed and causes the pain. It is a very large heel bone, can form a spur shaped protuberance which is extremely painful because as it touches to the ground, it causes pain to the bone and to the foot. And here one can see the heel spurs, the calcaneus heel bone, and the heel spur that is going to just cause pain and inflammation to the plantar fascia and damages the plantar fascia, so cause of extreme pain. Now, introduction continued. It is a form of exostosis, mean out projection of the bone. Foot is exposed to the constant stress. Calcium deposits built up on the bottom of the heel bone, and repeated damage cause these deposits to pile up on each other, and that is causing a spur shaped deformity called a calcaneal or heel spur. 70% of the patient with the plantar fasciitis have a heel spur because heel spur causes the inflammation of the plantar fascia, so that leading to the plantar fasciitis. And this heel spur can be seen on X-ray. Many patients without pain symptoms can have a heel spur and not necessarily causing the pain. So here one can see the calcaneus bone, and there is smooth out margin of this bone, and here again the smooth margin of the. But in case of the heel spur, one can see the spicule, the pointed end coming out from this calcaneus bone here and there, and here one can see that is the classical heel spur which is visible on the x-ray of the foot lateral side. Now, the exact relationship between the plantar fasciitis and the heel spur is not very clear. Patient feel permanent pain in the heel and feeling of some hard thing in the heel. It forms where the plantar fascia joins the calcaneus bone, and the lifestyle modification, laser therapy, dry needling, and calcaneal taping are the treatment modalities to get relief from this pain of calcaneus heel spur. Here again one can see the heel spur causing the pain, extreme pain on this heel, and also that is just the heel spur is going to cause the inflammation of the plantar fascia leading to the plantar fasciitis. Now, epidemiology, mostly asymptomatic heel spurs are common in normal people, adult population, but 11% of the adult population had developed a calcaneal spur showing as incidental radiographic finding when you get an x-ray for some other reason, and that also shows you the heel spur. It affects about 13% of the population with symptom and pain. Now, types of the heel spur, there are two main types, and these are dorsal and plantar. As the name are, they are also just self-explanatory. First, the dorsal heel spur, calcaneus spurs located at the back of the heel. These are often associated with the Achilles tendinopathy, and these are present on the dorsal side of the heel. The other type is plantar heel spur. It is the calcaneus spurs located under the sole on the plantar side of the calcaneus bone. These spurs under sole are associated with plantar fasciitis because these are causing the inflammation to the plantar fascia. Apex of the spur lies either within origin of the plantar fascia on the medial tubercle of the calcaneus, or it is lying superior to it in origin of the flexor digitorum brevis muscle. So here one can see the spur on the dorsal side, that is the dorsal spur, and the spur on the plantar side, that is the plantar spur. So here one can see the retro heel spur, which is basically the dorsal spur that is on the back of the heel. And here one can see the calcaneus spur that is on the dorsal side, so that is dorsal spur, and here that is on the plantar side, that is the plantar spur as it has been highlighted. Now, types of the calcaneus spur continued. There are two types of the calcaneus spur by another classification, that is type A spurs. These are lying superior to the plantar fascia insertion, and the type B spurs which extend forward from the plantar fascia insertion distally into the plantar fascia. The mean spur length of type A is longer than the mean spur length for type B. Patients with the type B spur present more severe clinical symptoms. As one can see, this is the type A spur. As one can see, it is just projecting upward, and it is not just going to hurt the plantar fascia much as compared to this plantar type B. As one can see, that is just larger and going into the plantar fascia, and that is type B, and here it is type 1. Now, another types of calcaneus spur are inferior calcaneus spur. It is located on the inferior aspect of the calcaneus, so the name is inferior calcaneus spur. It is responsible for plantar fasciitis, and it is in response to the plantar fasciitis that is causing this bone spur, or ankylosing spondylitis. Typically in children, these are responsible for inferior calcaneus spur. It consists of the calcification of the calcaneus, which lies superior to the plantar fascia at the insertion of the plantar fascia, that is the inferior calcaneus spur. The posterior calcaneus spur develops on the back of the heel or the calcaneal bone at the insertion of the Achilles tendon. It is often large and palpable through the skin, sometimes removed in the treatment of the insertional Achilles tendonitis, and lifting heavy weight may exacerbate the issue. So here one can see the inferior heel spur on the inferior side of the calcaneum, and that is the posterior spur on the posterior. So this posterior can also be called the dorsal, and here one can also see the posterior spur, and this is the inferior spur. So these are the different names given to these spur. Now another classification of the calcaneus spur is type 1, that is large in size, but it is asymptomatic because angle of the growth of the spur is that such spur has halted the inflammatory changes. Number 2 type is large but painful on weight bearing, as calcaneus has changed by a depression of the longitudinal arch. So spur is at the weight bearing point, causing intractable refractory pain. So it is painful. Now the type 3 is a tiny proliferation. Outline is irregular and jagged with area of the decreased density around origin of the plantar fascia, showing subacute inflammatory process. So here one can see the type 1 and the large type 2 and the tuberosity a bit just origin, that is the type C or type 3. And if someone think that one is too small to make a difference, and it is the said by the Dalai Lama that try to sleep with a mosquito in the room, but it can cause you problem, the tiny mosquito, then you will come to know the tiny things are not very small things can make any difference. Now, the different risk factor for the calcaneus spur are age, certain types of the exercise, foot mechanics, and occupation. Obesity, due to the overgrowth and overweight, there is permanent stress on the posterior part of the calcaneus bone. This causes loss of the tendon on that part being replaced by the new bone formation, that is leading to the spur formation. A tight Achilles tendon and a lifestyle with little exercise, sedentary habits are also the risk factor. Then result of the biomechanical imbalance that causes an increased tension placed on the plantar fascia, that is also leading to the outprojection of the calcaneus bone as spur. Now here one can see the obesity and inward bending of the foot and not proper wearing shoes and the occupational posture problem, prolonged standing and hard surfaces that can also lead to the spur formation. The factors continued. Occurrence of the plantar fasciitis in non-athletic population is which lead to the calcaneus heel spur formation. This is not seen in athletic population, but because of obesity and the sedentary habits, these non-athlete can have a problem. Walking gait abnormalities which place excessive stress on the heel bone, ligaments and the nerves near the heel are the risk factor also. Running or the jogging, especially on the hard surfaces, and poorly fitted or badly worn shoes, especially those lacking appropriate art sports, are also the risk factor. Now, etiology or the reason of this calcaneus bone not very clear, but heredity metabolic disorders, tuberculosis, systemic inflammatory disease are implicated and involved in spur formation. There occur a crack and the inflammation in the bone, followed by the repair, resulting in the healed spur. Mainly abnormal biomechanics means excessive or abnormal pronation cause the plantar heel and the inferior calcaneal spur formation. There is calcium deposit built up in the posterior inferior part or underside of the heel bone over a period of many months by the repeated trauma and the strain of the foot muscles and the ligament, stretching of the plantar fascia, and repeated tearing of the membrane that covers the heel bone. These all are reason for spur formation. And here one can see the heel spur because of the repeated trauma here. Now, continuing the etiology and the reason, it is seen in the athletes whose activities include large amounts of the running and the jumping, spur formation, medial tubercle of the calcaneus, and intrinsic heel musculature cause constant pulling effect on the plantar fascia, resulting the inflammation of the plantar fascia, the disease caused plantar fasciitis. There are numerous muscles and the plantar fascia which exert a traction force on the calcaneus bone. Women have the higher incidence of the heel spur due to the types of the footwear they wear regularly, and the heel spur mostly seen in the middle-aged men and the women due to the osteoporosis, which is also an aging disease, but it can be found in all age group. Now, the clinical features of the calcaneus heel spur are: heel spurs are often painless unless associated with plantar fasciitis. Patient feel permanent pain in the heel, feeling of some hard thing in the heel, I have already told you. Pain in the heel and the bottom of the foot, most rare with first step of the day, waking up in the morning or after rest. The simple sentence of the patient can help you in the diagnosis. When the patient wake up, the patient is unable to reach to the washroom and taking the support of the wall, and then afterward with the rise of the sun the pain alleviates, and that is the sentence the patient says, that unable to go to the washroom after waking up. That is giving you a lot of clue about the calcaneus heel spur and plantar fasciitis. Pain is worse after exercise, not during it. Pain occurs where plantar fascia joins the calcaneus bone. Heel spur cause extreme pain in the rear foot while standing or walking. And here one can see the area of the pain, the calcaneus bone, heel spur, and the area of the plantar fascia. And here one can see the area of the pain from the plantar fascia can go up to the calf muscles and up to the near the whole leg. And the dorsiflexion and the plantar flexion, that also causes the pain because it put, if you do the extreme dorsiflexion or the plantar flexion, it put stress on the heel bone and heel spur will be injured and it can lead to the pain. Now, clinical feature continued. Running, walking, or lifting heavy weight may exacerbate the issue. The pain is localized at the medial process of the calcaneus tuberosity. If the inflammation develop at the point of the spur formation, region of the plantar aponeurosis attachment to the calcaneus bone, the cause of this pain is not the heel spur itself, but the soft tissue injury associated with it. Pain is described as a knife or pin picking into bottom of the feet, and the pain that later turns into a dull ache. And here one can see the area of the pain, and that is the heel bone, and that is the area of the maximum pain. And here there is the plantar fascia, which is just going to be injured by the heel spur.